Hello, good evening, everybody. My name is Tim Saka, and I'm the board president for CMY Rice Center. And we are uh, quite excited tonight for all of our wonderful friends joining us for the friendship event. This is the 15th annual one that we are trying to organize on a virtual setting. Normally, this event is happening on our center in the south side of the city, on our CMY Rice Center, and we serve a beautiful Turkish dinner for all our guests. And we every year we talk about a topic, a theme throughout the evening. But unfortunately, this year we had to go to the virtual setting. But still, our friends are here and our community is here. So we are going to be talking about a special topic tonight. Our topic is honoring the healthcare professionals during the pandemic. Our life has been changed tremendously last year. I was checking the news that it was just 7 months ago we had the first case of COVID in Onondaga County, and since then our schools has been closed and our families has been going through a lot of tough time. But we just want to kind of take a break from those news and then just say thank you to the people who really served when we needed the most. So it is really a special night for us to be able to show our gratitude for the healthcare professionals. It can be the doctors in the hospitals or the nurses doing testing, or healthcare professionals serving at the nursing centers and different places like that. So this night is their night. And we are also honored that we'll be having the keynote speaker, Dr. Indu Gupta from the Onondaga County Health Department. So there's also a bunch of other good speakers also will be joining us tonight. So we are all excited for that. But before we go into that topic, I would like to talk a little bit about our center itself. Friendship events are our biggest event throughout the year for our CMY Rice Center. And we have done the last one in 2019, talking about the other topics, like we talked about the lead poisoning among children with the lead paints. We talked about the childcare crisis on Onondaga County. And now this year we'll be talking about the healthcare professionals during the pandemic. Our center also, beyond these special programs, we do have Weekend Academy for our children who can come on the weekend to get tutoring and classes from us. We are also organizing programs with our ladies club, that they do online cooking classes or different activities like that. We do Turkish cultural events. We do interfaith events throughout the year. So I'm gonna go ahead and share a quick video about the activities we have done in a year. And while we were doing the video, we were surprised how many we have done. There are so many different things were happening. So everybody was surprised about that. So let me go ahead and share that video, and then we'll go ahead and start our program afterwards. And first of all, I would like to now also apologize ahead of the time for all the technical difficulties, because this is virtual event and there's always something goes wrong. So we'll do our best to go smoothly, but I want to apologize from the beginning to make sure that everything will be going smooth. That was a quick little summary of our activities throughout the year. That we had Turkish coffee nights before the pandemic, that we were able to get together and have a Turkish coffee and discuss the legacy of Dr. Martin Luther King in our center. And we have done like a ladies panel discussions and different programs like that. But unfortunately, nowadays we had to be able to do it online on the virtual section, but still we are going to continue with our activities. Coming back to our topic for tonight, we are talking about the pandemic. We are talking about what we had to go through as a country, as a nation, as our own county, about the challenges of dealing with this kind of a virus who affects everybody. And the virus was able to kind of dominate our life from beginning to end, that it didn't discriminate. It didn't discriminate who was going to get infected. And all of a sudden, we were hearing hundreds and then thousands of people getting infected. And unfortunately, we have lost many people in this process, and it just broke everybody's heart. In Islam, maybe there are similar stories like this in the other faith traditions also, that God says that when I was sick, you didn't come visit me. And the human being told God, how could you be sick? You are God. And God said, there was a sick person in your neighborhood and you didn't visit that person, and I was with that person and you didn't visit me. And then it kind of goes on like, I was poor and you didn't help me. And people say, how can you be poor? You're God. And God said, there was this poor person in your neighborhood, in your family, and you didn't help them, and I was with them. And kind of similar examples goes on like that. So during this time, when we needed most, the people from the health profession stepped up, and when everybody was running away from the virus, they went right into the place where the viruses were. They were testing people, and when somebody was getting tested positive, they were the first place to try to treat them and save their lives. There is also another part of the Islam. In the Quran, it says that killing just one person in Islam, accordingly, equals to the killing the whole humanity. That is how it is taken, that that one person is so valuable that just killing an innocent person equals to killing the whole humanity. And the Muslim scholars say that it is also the opposite way, that if you save the one person's life, it is as if you are saving the whole humanity's life throughout the whole earth. So when you look at those healthcare professionals, that they are saving lives on a daily basis, that when they need the most and they are sometimes so desperate and helpless, they are there stepping up and making changes. And especially on our community, on the Onondaga County, we have had a lot of wonderful stories, that we had a doctor from the Upstate Medical University inventing the saliva test so we can test people a lot faster. And that is happening right now on my campus at the OCC. It was also kind of taking over by the NBA and NFL, and now SalivaTech has become the first FDA-approved testing in the country, because those people in this area stepped up and they made that invention. And then there are many different stories like that we are going to be sharing tonight, and we'll be giving the community service award for these special people. So it's going to be a wonderful event for everybody. Now I would like to invite our guest speakers to share their remarks with us also during the night. I wanted to ask if we have the county executive tonight joining us, that he said he was able to come with tonight. So is he here on one of our guests here? Can we check? Mr. McMahon, are you here among the guests? Okay, it looks like he wasn't able to join tonight, that he wasn't sure because of his busy schedule. And as you know, nowadays, the COVID-19 unfortunately start taking a little bit kind of an uprising in the numbers, and he had to deal with them and confront them on a daily basis. He said that he was able to maybe join, depends on the schedule, but maybe later on in the event he might still join us. But coming back to the topic, that our county was one of the earliest counties to be able to see the challenge and immediately take steps towards dealing with this problem. That the social distancing and mask regulations and other regulations throughout the community, our county was one of the first one to be able to make those changes while the rest of the country was still kind of questioning what to do. And in this kind of challenging times, we had a wonderful leader in our community. Her name is Dr. Indu Gupta. She kind of became a celebrity right now, that every day she is on TV telling us what to do during these times. And we are so glad that we had a leader like her who can really give us the right leadership when we need it most. That she was able to consult with the school district to make sure what is the best way to be able to take regulations for the safety of our children. She was consulting with the Destiny Mall so it can follow the regulations to operate businesses and also operate with the public safety in there. So it has been quite a challenging couple months for all of us. But as I said, we were glad that we were able to have our commissioner of the county health department throughout these tough times. So I would like to now invite Dr. Gupta to share her remarks as the keynote speaker for tonight, talking about the challenges we have faced throughout this pandemic. Dr. Gupta, are you there? Can you hear me?
Yes, I can hear you. Thank you, Tim. I appreciate it. And good evening to all of you. You have been kind in your remarks, and I am glad to see many of you have joined. So I would like to thank you for inviting me to this evening event. I wish it was in person, but we live in a pandemic, so that's the nature right now. So as a proud representative of the Onondaga County Health Department, I'm fortunate to have known CNY Rise organization for the last several years. I actually, in fact, attended a few years ago an event about, I think it was about related to lead exposure. So as I look at your motto of we rise, in quotation, we rise by lifting others, unquote, unquote, is the very first step to show respect, inspiration, and service to the community with utmost empathy, which is very important in this day and age. This is the recipe for a strong and connected community where relationship matter for the betterment of humanity. The few things which you mentioned, we couldn't do it alone. We needed everybody. And so as I look around in the community, the exuberant spirit of collaboration is what have stood out during these challenging COVID-19 pandemic times. From health systems, including those people who work in the hospital and non-hospital related medical community like the outpatient doctors, to nonprofits like yours, city and county agency, including law enforcement, educational institution, and nonprofit organization like yours. And most importantly, the individual residents of this wonderful community. Together, we have been able to fulfill one of the most important goals of all, to protect and improve the health of patients, whether we can call it patients depending on where we work, or clients, or colleagues, family members, and neighbors, right? In doing so, we have affected the entire community. This is power of us in a capital letter, right? And this also is the core mission of our Onondaga County Health Department. I myself am fortunate and honored to have had that opportunity to serve as Commissioner of Health of Onondaga County for past 6 years. It seems like I just started and suddenly this pandemic came. We have done a lot of those things in the last several years, but it seems like everything is a blur now. And I have been working alongside with members of our community before and during this ongoing public health crisis of COVID-19 pandemic. To have a healthy community, we need everyone to work together, and we actually do. So we continue to work together by following, especially in this pandemic time, by following public health principles, which are data-driven and based on science. Whether it was a direct patient care involving any treatment, coordinated discharge planning, follow-up, or ensuring we are able to address the need for shelters, food, medicine, childcare, and mental health needs during these unprecedented times. So under the leadership of County Executive Ryan McMahon, a coordinated response along with all county agencies, including the city of Syracuse and all the other municipalities, nonprofit such as yours and many more, and the individual citizens of a community has been successful at this point and has been inspiring and has impacted lives of everyone in Onondaga County. All of this is literally, in a way, it's a personification or definition of health. as our daily life significantly changed when the virus began spreading globally at the beginning of this year. The World Health Organization defines health as a dynamic state of physical, emotional, and social well-being, and not just the absence of disease. When our health gets off balance, as seen by during this pandemic, we start to really understand the importance of mutually complementary roles within the health systems and public health. So when I say health system and public health, so public health includes everyone. It's not just the agency like our health department. It means many of you who are attending this and those who are not. So we must look at the health through the lens of public health, which is defined by Professor Charles Winslow in 1920. That was more than 100 years ago, right? Which is true in 2020, especially during this raging pandemic, which is defined as, quote, he says, public health is the science and art of preventing disease, prolonging life, and improving quality of life through organized efforts and informed choices of society, organization, both private and public, communities and individual, unquote. So it is important to understand how powerful that is as we work together in our community. So this pandemic has proved this definition to be 100% accurate. What happened and is happening now is not the job of one organization like mine or or just a hospital or a person, but is a joint collaborative endeavor that includes all of you who are here today and those who are not here as well, with only one goal of good health for everyone. And yes, while it is complicated and at times very difficult, it is achievable and within reach. As the race for vaccine and treatment continues and willing, collaborative and committed community partnership is prevailed. So the same is true for all of our health priorities of whether we talk about reducing chronic disease like diabetes, high blood pressure, heart disease, cancer, addressing mental health and substance use, supporting mother, babies, fathers, and families, in addition to effort to reduce impact of infectious disease like COVID or TB, or sexually transmitted infection, including HIV, and maintaining safe environment to have safe water, safe food, right? Irrespective of age, gender, race and ethnicity, sexual orientation, disability, geography, and nationality, to name a few. We have always advocated for health equity where everyone has the best opportunity to achieve best possible health, and we will continue to do so. This pandemic uncovered how much health inequity exists globally, nationally, state, and at local level. However, the uplifting part of all of this work is that we are doing collaboratively to find the root cause of disease and disability, not just to treat it as a short-term fix, but rather strive to halt, eliminate, and further prevent this from happening again. It's really, it's very heartfelt and gives you, there is a future for us, right? We are seeing COVID fatigue, a reluctance to follow all the public health recommendations, such as if you tell somebody to wearing mask, avoid large gatherings, and working while sick. As the virus continues to show its wrath throughout the community, we started to see problems in our community. Our work has becoming more challenging as case continues to rise more than 100 cases per day for the last several days because of small to large gatherings and parties, which may seem very innocent, but we started to see those patterns. Traveling where you shouldn't be going, sports, bars, and so many other factors as communities open for business. We, of course, want our community to open for business, but it is a balancing act. How do you balance that? We must also be diligent in following the strict public health guidance. As you all know that, it seems like a broken record, but it's unfortunately still true, is the mask wearing, hand washing, symptom checks, staying home, and getting tested when sick, and respecting isolation and quarantine rules, because they are the one which pretty much break the cycle of transmission within our community. These will remain true even with the availability of a vaccine in the near future. Many of you have heard the breakthrough news. Yesterday was all over the place, which shot up the stock market to the roof with the Pfizer's 90% effectiveness. But still, it's not here yet, and that still will be limited. So we are talking about availability for this vaccine for the general public until next spring. I think we have to be very cognizant. What we have in our hand is what I just alluded to: wearing your mask, hand washing, symptom checks, and staying home and get tested. So currently in the absence of definite treatment and a vaccine, these public health principles are the backbone to keeping our community safe and open for business, whether it's a school, restaurant, manufacturing, gyms, and entertainment. We need everyone to work together to put this pandemic behind us. And we certainly can do that, but we need that spirit to continue to do. I want to acknowledge and thank all the healthcare workers in taking care of those who are sick, and also other essential workers who are working every day to support this community, from grocery store person and food delivery person to transportation, sanitary services, and the public servants, especially those in county health and human services. Our team of public health professionals is at the forefront of this pandemic, working 7 days a week to serve our community. Let's continue to work together to bring this pandemic to an end, as well as other health issues such as diabetes, heart disease, substance use, and mental health crisis, to name a few. So our community can continue to heal and thrive beyond this pandemic. I know we can do that, and I just am here to remind that there is always at the light at the end of the tunnel. After the night comes the morning. So stay safe and stay healthy, and thank you.
Thank you so much, Dr. Gupta, for your wonderful positive message. That nowadays we need those kind of supporting messages that yes, we can go through this. It will take all of us as a team to work together and make it happen. It has been quite a challenge for everybody. And as you mentioned, that there's a little bit of a fatigue right now in the community to deal with this on an ongoing monthly basis. And I wanted to also ask you, while you are here, since everybody is concerned right now, is that we have seen a recent increase in the numbers, and many people are kind of nervous right now that we are going to go back to the shutdown, that the activities, programs, the businesses or the schools will be shut down. That I know you cannot have answer for everything, but what is kind of your suggestion or ideas for everybody for this kind of a challenge, to see that we are going to deal this now one more time with big numbers and big percentages? What will be your feedback for that?
Right. So the same thing as I alluded in my remarks was that we, as the people, have the power to do a lot of those things. In the absence of vaccine and definitive treatment, like a prophylactic treatment you take for flu, if you have a flu, the doctor can give you antiviral to prevent. In COVID, we don't have anything. So the only thing which we have is staying home and mask wearing and making sure keep the physical distancing, all these things. Yes, we are seeing, unfortunately, rising number of cases because people are being somewhat careless. I'm not going to sugarcoat that. The facts are facts. And the small steps, if people can take it, that will go a long way to keep the community open and safe. At this point, there are no plans to shut the community because that sometimes can backfire. That's not the intent. So our message is to get yourself tested, make sure you protect yourself, protect your family, and try and avoid all those small little get-togethers, which you are so dying to have. That they will be tomorrow, they will be next year, right? Why does it has to be right now? So Thanksgiving is coming. That's the one of the big one. Then in December, there are other things. So if you see, we have seen this, what current things which you're seeing is the part which we saw in Halloween, that people did have a lot of parties. And we are seeing those 7 to 14 days, we suddenly have explosion of cases. So, when people do get together, so those things talk. Infection jumps from the virus jumps from one person to another one. The closer you are, the happier the virus is. So we provide that opportunity for the virus to jump from one body to another one. And we have the power to break that. And that's what we are going to ask. County executive has been very involved. I was just got off the call just before that. He couldn't attend this here. I have promised, so I was going to be here, and then I made sure that I am going to continue to communicate. Um, and it is important that people should do everything as best they can. Right now, you saw that yellow zone designation came from the governor's office. We are working with the school district to ramp up the testing, and also at the same time, testing in the community. Schools are not transmitting infection. So the seems like that's not the right focus. However, the community should be a focus, because those parents, those teachers, those friends and families of the teachers, and then all those are the one who are having some get together. People are going to the bars, people are having fun time. Somehow those people got exposed to them, and rest is history. So what we do today, there are repercussions of that. So I would like you to spread this message, reassure people, get tested. I would encourage you to all visit our website at, if you Google Onondaga County Health Department, at the main page, there is, it says COVID, you click on it, you will have all the information at your fingertips. That includes data, which you should really be get updated information. We update it every day, and testing sites and anything else you want to know. So it is, information is power. It is very important. The more you know, the more you will engage. And if everybody who is attending talks to 4 different people, you have disseminated that information. They will talk to 4 different people. So that's how we can continue to protect. So everybody has a role to play in this, and I don't think you should underestimate your own power. So we are all in it together, and we are going through to conquer it together.
Thank you so much, Dr. Gupta, again, for your wonderful explanations that we have the good track record in our county, especially in this area, to be able to step up to the challenge. And I still believe that our community will do the part on their side. And
Right.
like you said, the nonprofit organizations like us, we need to be keep active and keep informing people about the regulations and how to deal with this current pandemic challenge right now.
Yeah, so
It,
only one request I will have: if you have, email or communication through the members of the community and all those who are, just continue to hammer the message, is that power is in your hands, and take the power in your hand to spread the transmission of this virus. And everyone, if they take that step, they actually can reduce the transmission within their family, within their friend circle, just following all those rules. So what my challenge to all of you is, are you stepping up to that? And I hope you will. And you have the power to do that. You are our partner. So I am counting on all of you.
Thank you. Thank you so much. And normally when we have this event in our center, this is the part that we start announcing the award winners for their community service for this year. So unfortunately, we are not going to be able to pass out the award right now. And before the event, I was in conversation with the county health department about specifying one of the members to receive the award. And they said that they could not specify one person. Everybody worked so hard with their limited sources and limited time to serve everybody. So
Right.
our members decided that we wanted to give an award to the whole department. So let me quickly share the picture of the awards that we have prepared for our members tonight. That we will be having the awards delivered after the event to each location with a little gift bag. And if you wouldn't mind, we would like to have the community on the county health department to receive this award from us for their service during this event, during this pandemic, unfortunately, because we are so grateful that we know they had some budget problems. We know they had a lot of unknown answers, that questions for everywhere, and they were able to come and do their job to serve the county for the health perspective. So we would like to extend this award to you, and you'll bring it to the office, and we'll be glad if you can share that award with all the staff members at the department there.
I am so delighted, and I'm so humbled to accept the award on everybody's behalf. I have a wonderful team, and we certainly will send you a picture of that after. We'll collect some people, and We truly appreciate it. And this is, my team works so long hours, 7 days a week. This has been quite a bit of challenge. They are exhausted, but they put up together and then keep on going and keep on going. And I think with the one goal that we serve our mission to improve and protect health of our community, with the mission, with the partnership, with our, the values of equity, and then also vision of the community partnership. It is so important. So thank you very much, and they will be thrilled to hear that. And word of encouragement, appreciation goes a long way. So thank you very much, and I will share the word when I will get that. We will share definitely with our entire health department. With the email and anything which you send it, we'll just make sure that it belongs to everyone, because they have worked so hard. So thank you. And we appreciate your partnership beyond the pandemic. That's something we would like to continue, and we always do. Okay.
Absolutely.
All right.
Thank you so much again, Dr. Gupta. Again, I know you are so busy that we were so grateful to have here as our keynote speaker tonight. And our doors are always open to you at our center. Hope to see you at another event, a coffee night or different gatherings like that.
Yeah, I know.
When we are done with
one day we'll have some good, nice food, right? Yeah. You will have to make sure it's vegetarian, because I'm vegetarian.
Absolutely. Anytime, definitely.
All right. Well, stay safe and take care of yourself, please, all of you. I appreciate it.
Thank you. Thank you so much. I would like
you
to say
take care.
Have a wonderful night.
Yeah, you too.
Thank you.
Okay, bye-bye.
Bye. Have a wonderful night. So now we would like to go to another story we would like to share. As I mentioned, I work also daytime on the community college. And when we were there, we also heard a lot of wonderful stories from the nursing department, what they have done to still trying to keep in touch with their students, still trying to teach, their classes, but still come back on the other side and serve for the community with the testing and doing their job as the volunteer nurses in different locations. So tonight we are also honored to have the department chair, Leanne Waterman, with us. So I would like to now invite her to talk about her department and introduce her members also. So give me 1 second. Hello, Leanne, can you hear me?
Hi, Tim.
Hello.
Listen, I want to say thank you to everyone who's here tonight. And most of all, as a nurse, I think I have to start by just reinforcing Dr. Gupta's message. Please, we can do this. Wear your mask, wash your hands, follow social distancing. We're almost there. We really are. And the rest of my message tonight involves what it is like to fight a virus, what it is like to work as a healthcare member, but most of all, how important it is to us to be allowed to be the people who serve. So we're so grateful to CNY Rise tonight for being honored for community service, because honestly, that is our honor and our privilege. I'd like to start tonight talking about my experience with another virus. I graduated from OCC in 1982 as a very young nurse, and I immediately went to work in the ICU. And shortly after that, I arrived at work one day to find all the nurses huddled together. They were talking, they were very angry, they were very, very scared, more than anything I've ever seen in my life. And they were talking about a patient who was coming from the ER who had a terrible disease. And nobody knew anything about this disease. All they knew was that it was 100% fatal, and that young people across the country, especially young men, were dying terrible deaths of this disease. As a matter of fact, nobody even knew how the disease was transmitted or caught. And so we were being told that we had to wear one of those big zoot suits, one of those big respirator suits, just like you see on the TV, where they're going to the moon. And the nurses were scared. They were human beings and they were afraid. And they didn't want to take care of this patient. And then all of a sudden a hero stepped forward. And that hero was my nurse manager, who walked up to the unit and she looked at my senior staff nurses and she said to them, listen, there is a person coming who needs our help. And I am a nurse and I am going to take care of him. And I want to know which one of you guys are going to help me. And so, of course, I put on my big respirator suit. And of course, I went in that room. And for the next couple of weeks, we worked side by side, taking care of him. And I'm going to tell you now, I'm sure you've all guessed that this person, we ended up having a disease that we learned later to call HIV/AIDS. And to this day, I'm so glad to be able to say that I stood on the right side of history, that I did the right thing. But most of all, I'm grateful to that nurse hero who taught me what a privilege and what an honor it is to be able to take care of people when they need it most. And so tonight, I'm going to introduce you to a couple nurses who I think have done the same thing. I believe that they have stood up and they have taken care of people at a time when they need it most. And they haven't done it all alone. So before I introduce them, I just want to tell you what it's been like. I don't even think you can imagine, I think you might be able to imagine how it is to try to train nurses in the time of this pandemic. It seems like every day we are facing new challenges, every day since March, whether it's a new regulatory agency mandate, every regulatory agency in this country we seem to have to respond to. Whether it is new hospital policies that affect our ability to send clinical students to clinical practice, whether it's our ability to actually teach students how to do hands-on care, even when we're not hands-on with them, and whether it's adjusting to new barriers that our students seem to face over and over. Yet every time I go to work, all I do is to keep reminding myself that I am grateful to be able to be here when my students and my community need it most. But I can't do it alone. So I did want to make sure that I thanked everyone at this college, including yourself, by the way, who stepped forward and helped us and our students make this happen. Everyone from Dr. Crable to all the administrators, to all the members of the faculty in their various roles, and to all the support staff, we have been working together tirelessly to get this to happen. All my mission to create new nurses to serve this community right now when they're so needed have just been buffered by this community. Especially, they've been buffered by my nursing faculty. I am so proud of them because they have been finding a way to teach in extreme circumstances. And also, they have been continued to be role models, giving direct care in the front lines, direct delivery of patient care right at the front lines, right when people need it most. I'm really proud of them. And they're here tonight to tell you their stories. And if Cindy Arcuri doesn't mind, I think I'll have her start to talk what it's like about being a teacher and a nurse in the midst of a historic pandemic.
Hello, Cynthia, can you hear us?
I can. Can you hear me?
Hello, hello. Welcome again for coming for this special event tonight. Thank you so much.
No problem. Thank you for inviting us. Happy to be here. Thank you, Leanne, for the nice lead-in. I do think it every day I take an assessment of what is going on and what we've accomplished and what we still have to accomplish, because just like Leanne said, it seems like each day there are more challenges than the day before. But we always have the blessing of always being part of a team. And I think I do have to contribute a lot of that to my medical background, because everybody in medicine always works as part of a team. So we're very used to relying on each other, holding each other up, seeing this as not my problem, but our problem. And we'll, work together and we'll come up with a solution. And we're also known for being, using our ingenuity in order to come up with thinking of new ideas outside the box to solve problems, because we can't do things the way we've been doing it. And for the ability to maintain the level of professionalism and care and specialty that we give to our patients, we had to think outside the box, and we all used our individual strengths. So, we all know each other's strengths and we call upon each other. And as a team, that comes up with some really beautiful ideas of how to resolve some of these challenges we've had. Because I really think I had the unique position of having 3 different challenges. I had to work in healthcare as a provider, taking care of patients in this totally different way of providing healthcare. I had to figure out how to teach students in a distance format and how to go about using technology to help fill in those gaps that we were missing. And then the combination of being a teacher in healthcare and how to manage to bring this all together and solve all those problems. And it's been really neat. I am very thankful to be a part of this this time in the way that I don't think I will ever look back on this moment in my life and not be proud of what we've accomplished. And not only to the patients, but to community and to our students, because we have managed to thus far, even though we shut everything down, no students will be graduating later than they were supposed to, because we managed to figure out ways to get everybody to graduate on time, because the healthcare system needs these nurses in the system to keep on taking care, because there is burnout and people are tired and people are getting fatigued by this level of intensity in their jobs, and they need more help to build upon that team. And I'm so impressed that as a department, we again used our individual skills to make sure that our students are graduating on time, and that for their lives is so important, and for everybody else's lives it's so important that we are having these nurses move out into the community. So it's been I as hard as it's been, it's also been very gratifying in the way of, just like you said, everything you give out, you feel the appreciation back. And the students really do appreciate, as the patients appreciate, us being there and sticking by them. And they know that we're in their corner, and that makes them happy to get through, because they know that we're not leaving them alone. So it's been
Thank you so much again, Cynthia, for wonderful service, the time that we needed most. And as we also know that you and other healthcare professionals, you have your own family members, and you need to also, I was hearing that sometimes you and others need to serve at the hospital, sometimes 2 days in a row. And then you also worried about getting your family, infected. So some nurses I heard was sleeping in their car so they wouldn't go into the house. There were many, many stories that we have been hearing. So thank you so much again for all the wonderful services you have done, that we are so proud to have you a part of our community there.
Thank you so much.
Thank you. And I'd like to now ask also, maybe Leanne can also introduce our next member from the nursing department also. Leanne, I think you are muted right now.
I always do that.
Yeah.
One of our newer members of the nursing department has also been amazing in helping us coordinate everything that needs to be done in our skills lab, but also she's been serving at the front lines at Syracuse Community Health Center, doing testing in the very beginning. And I know you have some pictures of her. And
yes,
Cindy, I don't know if you want to show them
absolutely.
now,
Go ahead
or
and
if I
share
should introduce Joanne and she can talk while you show them.
Let me go ahead and share the pictures that we have had, that the nursing department members have been doing testing in the community during the pandemic.
And Joanne, maybe you want to tell us about while she shows the pictures.
Good evening, everyone. I'm so glad to be here tonight. This pandemic that we're living through, and what we did in the community starting back in March, has been absolutely amazing. I almost like, I just feel that I'm so blessed to be a nurse. I'm blessed to be part of such a great institution at OCC. The faculty members that I work with are absolutely amazing. My experiences through COVID-19 were unremarkable. The people that I worked with down at the Syracuse Community Health Center were absolutely tremendous. Seeing a community come together like that to test all of these people that came through that were so scared, that were unsure of what was going on, if they were going to be okay, if they had it, if they were going to be on a ventilator. It was a very scary time for a lot of people back in March. Not only just going through the whole testing thing, but I think our students felt it as well. And that was hard for the nursing faculty as well. And seeing how we pulled together through that and got our students educated via Zoom or Teams or, whichever web conferencing we needed to use or get the job done, was amazing how we all pulled through to get everything done. Like I said, I'm so blessed to be a nurse. I went through OCC's nursing program and I graduated in December of 2011, and it was the best thing that I've ever done in my life. Besides get married and have children, of course, but it was a great, it was one of the greatest accomplishments of my life going through that program and becoming a nurse. And I've had a lot of great experiences since I graduated and been working in healthcare industry, but dealing and going through this pandemic has been challenging yet rewarding. And like Cindy said, we've really done a lot to make sure that our students are going to graduate on time. I give a lot of kudos to Leanne Waterman, who has done so much for our students to make sure that there are clinical spots for them, that we can, make this happen. She is absolutely amazing. And I always tell the students, don't worry, that Leanne will figure something out because that's what Leanne does. She's tremendous at making sure that everybody in the department is well, that our students are well taken care of, and that everything will be wonderful for them. And I would love to give a huge shout out to our students as well, because during a couple teaching sessions over the spring, our students would say, won't they let us in the hospital? Please, we just want to go and help. We want to help. They were feeling that pressure too, where they wanted to get in there. They wanted to be on the front line. And it was unfortunate because, they weren't allowed to, but they really wanted to. And seeing that emotion and dedication to nursing already, and they haven't even graduated, was tremendous. So I think that, we're really doing good things, and the community has really come together and made sure that people are staying healthy. And unfortunately, we are seeing another spike in cases, and we're just all pulling together again and dealing with this day to day. And, I wouldn't want to be in any other career than where I am. Nursing is absolutely wonderful. Teaching is so amazing. And like I said, I'm just absolutely blessed to have amazing colleagues at OCC and in the healthcare industry working together to get the job done.
Thank you so much, Kelly, again, that as the community members here in Wando County, we cannot say thank you enough to you, and you also your members of your department, that I was showing the pictures over there, that the moment the testing center happened, you were one of the first one to be there testing people day in, day out. And you were even scared to get out the door those days, but you were there with all your dresses and protection and everything. You don't have to be like a superhero or something to be out there. Just doing that makes you a hero. So thank you so much for all your services. I appreciate for your whole department there.
Thank you.
As we have been talking, just like the county health department with Leanne Waterman about the nursing department to see who we can decide who can get the community service award from the CMY Rice Center. And the general consensus was that we cannot give to one person. So we decided to give the whole department as a nursing department as the community service award. I want to quickly share right now is that this coincidentally actually 2020 has been announced the year of the nurse by the World Health Organization. And it is the 200th birthday of the Florence Nightingale. So this year was decided long ago to be the nurse of the years and the midwives. And it happened to be the year that the nurses was gonna be our heroes in the middle of the pandemic. So we are so honored to extend this award also to the nursing department, and we will deliver it with some couple little gift bags from our CMY Rice Center, and we'll bring it to the nursing department at the OCC.
Thank you so much.
Thank you, thank you.
Everyone.
Thank you.
We also have also right now the honor of having the president of the Onondaga Community College with us tonight. That we know that she has been trying to also recognize nursing department for their efforts at the OCC. So we'd like to now invite Dr. Casey Crable also to share her remarks about the challenge that we faced during the pandemic, but also the wonderful steps that we have taken from saliva testing to serving the students and the community. So I'd like to now invite Dr. Crable also for our event also. Hello, doctor, are you there?
Hi, Tim. Nice to see
Hello.
you.
Thank you, thank you. Good evening.
So let me start. I know she signed off because she was running to another meeting, I'm sure, but the college is deeply indebted to Dr. Gupta and her whole team. They've been a huge part of our planning and decision-making, and they have not steered us wrong. They've been wonderful. So I was so pleased to be here to see her recognized by you guys tonight. She's done a wonderful job, as has my amazing nursing department. So you have Cindy and Joanne and Leanne here as representatives of a powerhouse team. And I want to tell a little story about them that I think demonstrates sort of how they approach probably the world, but in this little microcosm with this pandemic. So the college closed on March 13th. And, you know, none of us really had, I think at that point, a sense of what was really happening, how long this was going to take, what we would need to do. We just knew we all needed to go home, be separate, and figure it out. And we heard from the county that supplies were going to be a challenge. So we thought, well, we have a nursing program. They probably have a couple of things that they could spare. So maybe we can get in touch with them. And so I walked over to the nursing department with a couple of folks on facilities, only to find that the department had already completely inventoried all of the supplies that we had, arranged things in a logical order that would be easy to transport, thought through the kinds of equipment that their colleagues would need, and generously emptied their closets before anybody asked. So I think that is really a good way to understand this group of educators. They are a team, but they're also on the big team. They are looking out for us, and they are working as hard as they can with their expertise and their compassion and their dedication to students, but also their dedication to the profession. And I think that's one thing that makes nursing educators really special people, that they have this dual dedication that is evident at all times. And you heard, I think, each of them talk about, being a nurse and being an educator. And it is that special sort of dual existence that fires up this group, and that just makes us incredibly lucky to have them and incredibly proud of the work that they do. I was delighted in August to be able to pin They're recent graduates out on the lacrosse field because you do what you have to do. But you could see in these new nurses the deep regard that they had for their teachers, the incredible sense of confidence that they had built in the work that they had done with their faculty. And so that you honored them tonight is so incredibly fitting because they have been heroic. So Leanne, I hope you will pass on to the rest of the department how much we value all of you, how proud we are of all of you, and how we are looking forward to you continuing to produce those fierce groups of nurses that we're used to graduating at OCC. So thank you for all the work that you do and the way that you make our community better and safer. Thank you.
And thank you so much, Dr. Krabbe, also for joining us tonight.
My pleasure.
You have the big picture that you are always in contact with the county executive officials. You are in contact with the upstate medical hospital, also your staff members, to see what's really the big picture to how to help the community. And it is a huge relief for all of us to know that we have people like you or Dr. Gupta to care about people and give that leadership. So as the member of the community, I want to say thank you for all your leadership and supporting in these tough times in there.
Thank you.
Thank you so much again. And now I would like to share also a quick little video about all the healthcare professionals that what they have done for our community. So if you wouldn't mind, let me go ahead and quickly share that with everybody.
It's interesting that the things we cherish most are the same things we walk right by. They become so intertwined in the status quo that ultimately it becomes impossible to tell them apart from our day-to-day. That is, impossible until things change. Because as it turns out, that thing we call life, it has a say. There's a saying, you never really know what you have until it's gone. And sometimes it takes the most abrasive of reminders, the harshest of times, to help us recapture that perspective, to lift us up and show us what we had previously failed to see. And while our darkest moments test our strength, they push our boundaries, even transform our reality, they can also be the bridge that leads us exactly where we need to be. They remind us that sometimes it's not about how we spend our time, but who we spend it with. That quiet brings clarity, and the world can spin so fast that we forget to think about our place within it. It reminds us how humanity is bigger than the sum of its parts, and it takes just as much energy to build up as it does to tear down. It reminds us that no matter where we live, what we speak, or who we pray to, we're not so different after all. It reminds us that there is so much more good in this world than evil, so much more love than hate, and so much promise for tomorrow. Someday we'll look back on this moment with the lessons we've learned, the hardships we've faced, and we will be reminded of the miracle that is the human spirit, unwavering in its resolve, unbreakable at its foundation, stronger than we could ever comprehend. See, sometimes it's hard to look around and find a reason to be optimistic, to understand or comprehend why. But what we'll find is that if we look hard enough, immersed in the uncertainty, the disruption, and in some cases, the tragedy, there's something to be gained. A tiny candle flickering in the night that will eventually grow to light our way. Because that road to tomorrow is paved with hope. There are pages unwritten, stories untold, and a new chapter to begin.
So we are always hopeful for tomorrow because of our wonderful people. They are with us. They are part of our team to make this change for everybody. And number of times, these are the people who are selflessly make the sacrifice for the better of the community. So we are so grateful for them. Thank you for the OCC Nursing Department and their leadership, and Dr. Krabel as the OCC president. Now we'd like to share another story from another wonderful organization that it's a little bit of something, how can I say, I kind of struggle with this a lot to really do this or not. I check with our members and everything, because tonight we would like to honor another member of our community from the Upstate Medical Hospital, and she's one of the nurses over there. Again, tested all the patients and the public on a daily basis, and I know why she was there in the first place, because her husband is our board member at the CMY Rice Center. It was kind of a conflict of interest to give an award somebody from our own, board members in there. But we said, what the heck, we have to do this because she was so special that we need to, on her behalf, kind of give award to the Upstate Medical Hospital also. That I know that she is the woman of faith, and she loves, God so much in her heart. She asked herself, if Jesus will be alive today, what will he do? And then years ago, she decided to go into the HIV, department to help those most vulnerable people, because she thought that was part of her faith. And just being on the autoimmune disease department, all of a sudden, COVID-19 has become her situation also. She was there as the first frontliners to test people and then also help them after they get tested there. So I want to now invite our Vice President of the CMY Rice Center Board, Tony Bartlett, her husband, to introduce her, and then we'd like to hear also her story right now. Hello, Tony, can you hear us? Hello, Tony, are you there?
Okay, yeah, can you hear me?
Yes, we can hear you now, and
Good.
hopefully we're gonna see you in a minute.
Right, good.
Okay.
I start. Well, my name is Tony Bartlett.
Tony, you are still kind of in dark right now. We cannot see you
Okay.
at the moment. Can you maybe turn on your camera?
And the host has to turn.
Let me see if I
It
can.
says you have to turn me on.
Okay, let's see. Did I do that now? Did I try?
You have to start my video.
Okay,
There we go.
there we go.
Okay.
Hello. So nice to see you again.
All right. Well, my name is Tony Bartlett, and as you can tell, I and my wife Linda did not originate in this country. I came from England over 25 years ago, and I happen to be it's just a coincidence, a member of the CMY Rise Center Board. There's no family special privilege here that my wife is actually right beside me and is getting an award tonight. I hope you believe that. We are honored. I am honored to be here tonight among so many health professionals. I am married to one. I remember the very day at the moment, about 30 years ago, when my wife stood at the kitchen sink in Norfolk, England, and said, I think I would like to train as a nurse. And she trained in the Norwich Health Department, the hospital there in the Norwich Hospital. And that was before we came to the United States. And it actually, her decision to do that changed my life, because I was then able to devote more time to study, and as a result came to Syracuse University to do a degree there. So that was the first person's life she changed. But coming here to the United States, she then got all her qualifications recognized here in the US, and then began to work as a nurse. And she has gone on to change, I'm sure, a lot of other people's lives here in the US. We're faced now, as everyone knows, with a 100-year crisis that the pandemic has brought to the healthcare system. I'm sure the healthcare system hasn't been under stress like it is at the moment for 5 generations at least. And I'm married to someone who experiences that on a daily basis. And I know that she brings comfort and healing, like all the nurses who have spoken here tonight, to the people that she deals with. And many times people who are lost to the rest of the community, lost to society, the face that they will see will be a healthcare professional. And they will bring them compassion, concern, and empathy and care. And I know Linda does that. So when Timur said they would like to recognize my wife, I thought it would be very embarrassing, as it is, but also very, very just and proper that she should be recognized. The situation that we're in is we're still right in the middle of it. And of course, as we all know, the cases are spiking. I remember in March when the stories were coming through from Europe and especially from Italy, where I spent some time, and it seemed to be horrendous there. And I was saying to my wife, "What's happening? What are the plans here? What are they going to do?" And very soon, those plans did begin to materialize out of the infectious diseases department in upstate health care. And from then on, she was at 550 Harrison, beginning the testing regime and the testing procedures there. She actually headed that up, and she devised a lot of the program, and she still is actually, in some ways, I should tell you, monitoring the cases. Well, whatever, that she's got her eye on it anyway. She's still in the zone. But anyway, I'm very proud of her, and I'm very glad to give her this award on behalf of Central New York Rise Center, which incidentally is a wonderful organization, and I am part of it. I help support it because I admire so much their principles of community service and of basically love for other people, for their fellow human being, which they have done so much to realize here in Syracuse. So that's me, and now over to Linda.
Thank you.
Hello, Linda.
Hi, thank you very much. I am very proud to receive this award. I feel a little humbled about it. I feel, as the other people tonight have said, that I feel that I accept it on behalf of my fellow workers and the team at Upstate. As Tony was saying, I'm a nurse. I was a nurse and now a nurse practitioner at Inclusive Health Services, which is really the HIV clinic at Upstate. I've been working there for 20 years. And then what happened in mid-March is pretty much the same story. On a Friday afternoon, my medical director came up to me and said, Upstate needs somebody to step up and get a testing center running. Would you do that? Would you help us do that? So I said, sure. When do you think you're going to want this to start? And they said, well, Monday morning. So this is so on the weekend we were setting it up, and very quickly we started at one site, but very quickly we had to move to 550 Harrison. And the only place that was really appropriate was the geriatric clinic. And I remember the first day I walked over there, and there was a huddle of nurses, and all they'd done, they'd spent the last few years looking after the elderly, and it was a very quiet clinic. It's probably the quietest clinic in Upstate. And now I'm asking these nurses to go out in the snow and start testing coronavirus screening. and there was a lot of fear at first, but they came through so well, so amazingly well, and very quickly, as Cindy and other people have mentioned. I think we're used to working as a team, and they very quickly stepped up to the plate, and we got that testing site up and running. And it's and I stayed there for a few months till the beginning of the summer, and then I went back to my other job, which completely had changed. And there's a whole set of adjustments there. We're trying to adjust to keep our patients as safe as we can. There's the transition to telemedicine when we can do that, but still to provide excellent care to the best of our ability. So it's been a lot of flexibility and being able to adapt and be creative in the way that we give care to patients. So as Tony mentioned, because whenever you place a lab order, you need a clinician's name attached to it. So my name is still attached to many of the coronavirus testing lab results.
That's what I was saying.
So what happens is that the results come through to my inbox. So I go in the morning and there are 500-600 lab results there, and I have to, part of my job at the moment at least is to still go through those results and make sure that the positive results are sent to people who can appropriately follow up with them. But like everybody else, we're all doing two jobs where we were just doing one job just several months ago. If you don't mind, I wanted to read something from Dr. Dewan, who is the president of Upstate. He sent out an email a couple of days ago to all of the Upstate employees, and I thought it was a kind of a good message to finish with. So if you wouldn't mind, I'll just read straight from his email. He said the following: "We know that your days are long and stressful as you juggle children, parents, schooling, and demanding work schedules, all the while trying to stay safe and retain a sense of normalcy for those you love. We miss our friends, our families, and our routines. The uncertainty of the last year has been stressful and draining in ways that we've never experienced. Local coronavirus cases are climbing around the country and in our own community. We need everyone to remain vigilant in their efforts to remain safe and stop the spread of the virus through proper hand washing, wearing a mask, and social distancing. As we face these rising infection rates, bringing us back to the dire circumstances of this past spring, we ask you to think back even further than that, to 1 year ago. If one of us had asked you, are we ready for anything? We believe you would have said, yes, of course, we are Upstate. So despite your weariness and frustrations, we are asking you sincerely to channel that same Upstate strong fortitude and remain resilient on the front lines of COVID-19. We encourage you to be gentle with yourself and to be kind to others, to maintain your incredible professionalism and dedication to your work, and to be proud of all that you have accomplished on behalf of Upstate, Central New York, and our nation as a whole. Stay positive, remain hopeful that better days are ahead, better days that are only possible because of you. We sincerely hope that you and your families remain safe and healthy as we head into the holiday season. And thank you again for all that you do. And I think that's a message that is appropriate to every healthcare worker in Syracuse and in Onondaga County. And so I'm very proud and honored to accept that award on behalf of my fellow healthcare workers at Upstate. Thank you, Timur.
Thank you so much, Linda. I just cannot express our gratitude that when they ask you to step up and say, we need to start testing immediately, even though a lot of odds were against us, that, you know, the testing facilities and the testing equipment and everything was just so challenging, that you and others stepped up and make those places for testing. And again, I'm so proud of our community in the County that we were one of the forefront of the whole nation for testing and getting people safe there. So thank you so much again for everything you have been doing. And I hope people now understand why we had to make that tough choice and then give the award to Linda Bartlett, because she was one of the heroes during this time. And so we are so proud of her. So let me quickly share again our little award together, if I can. Oops, it's not there, sorry. I also want to share one more story from the upstate New York that maybe you have heard this on the news.
History has been made here in central New York. A simple, cost-effective saliva test developed at Upstate Medical University has been given FDA approval. This is a game changer when it comes to tracking down COVID. We learn more now with News Channel 9's Josh Martin.
Today's a groundbreaking day for us.
Central New York in the spotlight. The FDA granting emergency approval of Upstate Medical University's COVID-19 saliva swab test on Wednesday. The test that only had state health department approval can now be used across the country. History for Upstate. This is the first test it's developed to receive FDA approval.
This is a huge step forward, and we are very pleased to be part of this solution in a terrible, terrible time.
The beauty of our test. The test has been done on local college campuses and at NBT Bank Stadium for student testing. This test saves time, resources, and money. In a little more than a month's time, Upstate got the thumbs up to try this, and now it can be used to help millions of people.
Be able to follow that process from the beginning to the end is very gratifying, and none of that would have been possible without the people who can take a dream, an idea, and turn it into reality.
With this saliva test, the SUNY College system has been able to test 120,000 people a week. In Syracuse, Josh Martin, News Channel 9.
And we have our full interview with Dr. Middleton for you to watch at localsyr.com.
There was another hero from upstate New York that he also stepped up in that critical situation to invent the saliva test, and that increased the testing numbers to hundreds and thousands of people in a short amount of time. And I know for the first time, because at the OCC we have been doing the saliva test with our students at the dormitories, and now the whole staff and students are getting tested. So we are so grateful for everything that these healthcare professionals did in the time that we needed most. And again, we would like to extend this award to all the staff members at the building there. So let me quickly share again, screen one more time. So we will be delivering this award to Frank Middleton himself also after this event, as well as Linda Bartlett, that with a little quick, like a Turkish gift bag, we will be delivering, and then this award will be delivered within a week to our award recipients this week. So thank you so much again, Linda and Tony. It is always to honor you, have you here, and thank you so much again for your service. Appreciate everything you have been doing. Now we need to move on to another story. We also have other guests from another health organization in the central New York. And as a Muslim American, I am also really proud to announce this, because when I moved to Syracuse from California, I heard about this infamous organization called the Rahma Clinic. And I was like, I know the word Rahma. It sounds Arabic. It sounds, you know, from the Islamic background. And I was like, what type of clinic is this? And then later on, I found out that I was true. It was initiated and organized by mostly the Muslim Americans in cooperation with the other members of the community from the health society to build this free clinic. And their perspective was to be able to provide healthcare for the people who did not have the healthcare coverage as an insurance, and they could help the children and the families. And then also during the pandemic, they also stepped up their efforts to be able to help the people who are the most vulnerable as the Rahma Clinic. So today we have one of the board members here, Mr. Muhammad Qatar, with us, and he also have the award recipient tonight to share their stories at the Rahma Clinic. So Assalamu alaikum, Brother Muhammad, can you hear me?
Yes, I can. Alaikum salam.
So nice to see you, brother. It's been a while, that inshallah you are doing good.
Yes, We'll see each other soon in person, hopefully.
Inshallah, inshallah.
Okay, tonight I want to introduce Dr. David Lehman. Dr. Lehman has been with us with the Rahma Health Clinic for a number of years now, for over 7 or 8 years. He has been with us. When I looked to introduce Dr. Lehman, I looked at his resume, and it's about 10 pages. You can for his resume. So there is a lot of things. I'm not going to read 10 pages, but I put a few things together. Dr. Lehman is a SUNY Distinguished Service Professor and an internist and a clinical pharmacologist at Upstate Medical University. Dr. Lehman founded House Calls for the Homeless under the auspices of SUNY Upstate in the summer of 2018. This program provides medical care free of charge to our homeless sisters and brothers directly on the street and at their shelters. He is also a volunteer, as I mentioned, at the Rahma Health Clinic that provides free medical care to indigent and uninsured individuals. One of his goals is to inspire our young medical students who often accompany him in the street for outreach, along with those students he is heavily involved with at the Rahma Clinic. As dedicated as he is to the care of his patients, he is equally committed to teaching his students by example the essentiality of understanding how to provide dignity through care to people living on the margins, of meeting individuals where they are, and of seeing the humanity in all those that they encounter throughout their careers. A brief description of the credentials of Dr. Lehman. His substantial teaching roles, he's teaching pharmacology at Upstate for undergraduate and graduate medical education program. He served as medical director of the SUNY New York State Department of Health Collaborative for Medication Use. He served as a reviewer for many clinical pharmacology journals and a member of the Board of Regents for the American College of Clinical Pharmacology. He has dedicated extensive amount of time in service to academic leadership as chair of the Pharmacy and Therapeutics Committee at Upstate University Hospital. He served as chief of clinical pharmacology inpatient consult service. He also served as chief of the section of clinical pharmacology in the departments of medicine and pharmacology. He served as vice chair of the Department of Medicine and chief of the Division of General Medicine. Professor Lehman has served as a practicing physician or a pharmacologist in many places around the world, including Saipan, Kenya, Ecuador, Nepal, and India. More recently, he has provided medical service through medical relief missions to Haiti, Ecuador, and Puerto Rico. In an article that was written about him in the Post Standard about 2 years ago, there were many large articles and many pictures with him, along with his able assistant Mia and John Timino from My Father's Kitchen, that they collaborate in reaching out to the homeless. Dealing with the patients on the street, many pictures. If you go back and look at this on the Post Standard, there are about 14 pictures. One caption on the picture says, "Homeless patients always seem surprised that the doctor doesn't cringe or hesitate when he touches them." He said, "He is listening to a man's heart." So he listens to the heart. He sees human beings, even on people on the street. He told me a story about a man that he really wasn't need to be washed and cleaned, and he helped in washing and cleaning him. Then he gave him the service. From my dealing with him, I came to know Dr. Lehman not just as an outstanding physician, but really as a man of faith, integrity, mercy, care, and compassion for everyone, I'm privileged and honored to know Dr. Lehman and to have him as one of providers at the Rahma Free Health Clinic. And he is a man definitely deserving of the award. Thank you.
Thank you, Brother Muhammad Qatir. David, can you hear us? Are you there?
I'm here.
There you are. Now finally we can meet you face to face. That I heard a lot about you. Now I can really see you in person. Thank you so much again for joining us tonight, and we'll be honored to present this Community Service Award for you.
Thank you. I just wanted to say that I've learned over the years that to see people as people, to try to provide dignity and respect to everyone we meet. And if we can touch someone just one time in their heart, and you can make a change in their life, and you never know what you're going to do. You never know what positive result can come from that. So I always hold out that hope. And one of my major goals is to convey to our young medical students, early in training, our nurses, as well as our pharmacy practice residents, the importance of providing dignity to everyone that you meet, and to really reach out to them and meet them where they're at, looking at them in the eye, not looking away, engaging in their space where they're at the time that you meet them, in their pain and their suffering, and to enter into that with them and guide them on the journey with that. It's an important part that I hope to be able to convey that to them early in career, before they can, all the different things that in life, in the health profession, that you can become jaded at. And I want to try to abrogate that and to have a little spark that they can carry with them in their careers. I am deeply honored to accept this award. I'm very humbled by this. And together we can build what Dr. King called the beloved community. And that's really what we're all about. Shukran.
Thank you so much. Shukran, Dr. Lehman, that it's been always inspiring to hear your stories and helping those people who are in need and vulnerable, that you're on their by side and just making change in their life. We are so honored and happy to have you in our community and look up you as our sample and model. We definitely appreciate all your efforts. I also remember from my Muslim background that in our faith, Prophet Muhammad says that we are like the same body together. And he said, if you have a broken leg, you can sleep that night. You cannot just say, okay, that's the leg, the rest of the body can just sleep. No, you cannot do that. Your whole body feels that pain. That when you have somebody in your community who are suffering and in pain, you shouldn't be able to sleep. You should be able to do whatever it takes to help them and support them there. And you are doing that in our community. So thank you so much. And we would love to, again, share this award with you for the Community Service Award with the CNY Rice Center. And we will be delivering this award next week to the Rahma Clinic on your behalf with a couple little Turkish goodies and gift bag. And please continue do what you do in the community. And it was so nice to know you and meet you. Thank you so much. Thank you. Okay, so these are the award recipients for tonight. But we have one more surprise for you. That as I mentioned before, that we have Weekend Academy for our youth, for our children. And we told them that this night we were gonna be honoring the healthcare professionals for what they have done for the COVID-19. So they prepared a little video for you that I want to now share this video that hopefully you will enjoy for their best wishes. So let me quickly share that also. So there was a
very nice.
Quick little thank you video from our children and the youth members from our center. They were also again so excited to be able to have the opportunity to thank all these healthcare professionals. So again, we would like to thank everybody who joined tonight. It was a lovely evening to hear all these wonderful stories from the healthcare professionals. And CNY Rice Center will continue to have different events and activities in the future. I want to share you one last information about our upcoming event. Our ladies club, the women's club, normally have monthly cooking classes at our center, and they cook cultural food and they share recipes, and they use that time as an excuse to start conversations with the other people, build friendships, and then share stories with one another. But unfortunately, because of the pandemic, we had to stop that. But now they are starting an online cooking class. And let me quickly share the flyer with you. It will be on, let me quickly share that one. Let's see, there we go. It will be on November 14th at 11 a.m. And you can RSVP through this email, cnyriseladies@gmail.com. And you will get a link for the recipe and the invitation for the event. So you are welcome to join for this special event. It's open to everybody. And they will be making celery salad, 3-2-1 buns, and carrot balls, which is, by the way, one of my favorite dessert in Turkey. So you're welcome to join for this special event on November 14th. And we will be, again, continue having different programs throughout the year that you are welcome to sign up for our email list, and we can update you for what's coming up in the future. I'm gonna now finish tonight with a little video to tribute to all healthcare professionals, what they have done during the COVID. I was just checking today that there has been 52 million people around the world has been infected by this virus, and it has been 1.2 million people died since the beginning of this pandemic. And it is, they're our people, they're our own family members, they're our own co-workers that have to go through this. But at the same time, we are also thankful for these people who tried their best to save us from this pandemic also. So thank you so much again. It was so lovely to have everybody here. Now I will say good night right now with this quick little video for tribute for all the healthcare professionals. Excuse me, there we go.
Is the year of the nurse. In honor of all that you do,
we've come together to say thank you. We see you, we hear you,
and we sing this song for you.
Thank you. Thank you. Thank you.
We're trained to run into the fire. We're trained to take care of the sickest of the sick.
Every patient that came into the unit, we saw pieces of our family in them.
Que todos vamos a una y nos ha unido muchísimo esto.
Thank you so much, everybody. Have a wonderful night. See you at the next event.
Thank you. Thanks.
God be with you. Have a great night. Thank you.
Good night. Good night, everyone.
Bye.